Activity Alliance Annual Disability and Activity Survey 2023 to 2024. Now in its 5th year, our annual Disability and Activity Survey continues to track disabled people's perceptions and experiences of sport and activity. This evidence helps us and our partners achieve fairness for disabled people. The survey was conducted by IFF Research between October and November 2023. 2,320 disabled and non-disabled adults aged 16 plus took part. 18 disabled people also took part in a series of co-facilitated online workshops with disabled co-researchers to discuss the findings and ideas for future action. Along with core questions on experiences, perceptions, and attitudes, this year's survey includes insights on how being active is affected by 4 key themes. These themes were developed from conversations with disabled people and feedback from organisations that deliver and promote activity. They are cost of living and benefits, outdoor spaces and active travel, mental health and well-being, representation. Summary of key findings. Participation and experience. Disabled people are consistently twice as likely to be inactive compared to non-disabled people, 20.7% versus 40.8%. A significant activity gap remains. Only 4 in 10, 43% disabled people feel they have the opportunity to be as active as they want to be, compared to 7 in 10, 69% non-disabled people. 3/4, 76% of disabled people express a desire to be more active. The top motivation to be active continues to be about being healthy. Findings show an increased awareness of the benefits of being active, but there have been no improvements in attitudes about disabled people taking part in sport and physical activity. There was a feeling of not being understood and valued by society in the workshops. 2/3, 65% of disabled people enjoyed the last time they took part in sport and activity, compared to 3/4, 78% of non-disabled people. The top barrier to being active for disabled people is their health condition or impairment. The legacy of COVID-19 and the cost of living crisis. There is a perceived decline in tailored opportunities since the COVID-19 pandemic and during the cost of living crisis. The rising cost of living is now affecting everyone's activity levels and how much people socialise, creating broad societal impact. Our findings show cost of living is disproportionately impacting disabled women, younger disabled people, ethnically diverse disabled people, and disabled people with 5 or more impairments. Low-income earners in the workshops were particularly concerned by the rising costs of basic bills, such as energy and food, making it difficult to justify expenditure on paid membership, sport, and physical activity. Disabled people are therefore more likely to consider sport and activity to be a luxury rather than a necessity. Just over 2/5 of disabled people, 44%, agreed that when money is tight, the cost of being active is one of the first things they look to reduce. There is a consistent fear between the years that being active will result in benefits or financial assistance being taken away. Around 2/5, 38% of disabled people have this fear. Outdoor spaces and active travel. Consistent with findings from last year, disabled people want to take part in physical activity in outdoor spaces like parks, countryside, or woodland. However, less than half, 44% of disabled people say it is easy for them to physically access outdoor spaces, versus 78% of non-disabled people. Only 14% of disabled people say nothing stops me from being active in outdoor spaces, compared to 29% of non-disabled people. Planning activities outdoors can add a degree of anxiety for those who feel particularly vulnerable about accessing and using these spaces. Travel via public transport can be daunting for disabled people compared to non-disabled people, particularly for users of mobility aids. Just under half, 46% of disabled people have a preference to actively travel. Travelling to an activity is considered a form of activity and exercise in its own right. Mental well-being and loneliness. Disabled people are still experiencing significantly poorer mental well-being and higher levels of loneliness. Disabled people are significantly more likely than non-disabled people to say that they often or always feel lonely. 20% versus 11%. 2/3 of disabled people agree that being active could help them feel less lonely. 66%. Disabled people with various protected characteristics, including ethnicity, gender, sexual orientation, low economic status, multiple impairments, and younger age groups, are more likely to experience loneliness. Representation and belonging. Disabled people are more than half as likely to see people like me participating, working, and volunteering in sport and physical activity. Disabled people often feel overlooked and underrepresented in many areas, including the sport and physical activity sector. The Paralympics was considered a good example of positive representation for disabled people. But most could not relate to Paralympic athletes and felt this did little to improve understanding. Only 9% of disabled people agree they have the opportunity to become a coach or take on a role in delivering sport or physical activity, compared to 24% of non-disabled people. Disabled men, younger disabled people, and disabled people in lower social grades are more likely to want the opportunity. Creating a sense of belonging for disabled people is just as important as having accessible opportunities. There has been a small increase from last year in disabled people saying activity leaders included me in the session and met my needs, 83% and 75% respectively, up from 79% and 72% last year. To view and download our annual Disability and Activity Survey 2023 to 2024 full research report, visit www.activityalliance.org.uk/annual-survey. Please contact our research team to discuss how to access, interpret, and use the data. Research@activityalliance.org.uk